What's really interesting in Canada is that about 95% of Canadians live within a 5-kilometer radius of a community pharmacy. And Canadians actually see their pharmacists up to 10 times more frequently than any other healthcare provider. So the pharmacy is generally the first and most frequent touch point that most Canadians have with the healthcare system. So we think that really represents a huge opportunity for pharmacies to be able to play a significant role in patients' care in general.
Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we believe that quality measurement leads to better outcomes. Let us become your go-to source for all things related to quality and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the Equip platform can help you with your performance goals, and we will also make sure to keep you up to date on pharmacy quality news. So buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. This is your host, Nick Dorich, and we welcome you to the PQS Quality Corner Show. If you listened a few months ago to our Season 1 review, we talked about our listening audience and who uses Equip. While most of the listeners are coming from the United States, there is also a bit of an international audience. This is the case with our neighbors to the north, that being the country of Canada. And PQS is already engaged and working with some organizations in Canada, and yes, that means there is a Canadian version of Equip data too. As we expand our audience into Canada, we'd like to say Happy Pharmacy Appreciation Month with a hashtag PAM2021 to celebrate the extraordinary role pharmacists play in healthcare. This is a recognition for the pharmacy profession in Canada, which is celebrated each March. So this episode also serves as our acknowledgement of pharmacists in Canada. Just like in the US and everywhere in the world, pharmacists are on the front lines during the COVID-19 pandemic, providing excellent services and care for their communities. And therefore today, we will highlight what Canadian pharmacists are doing to provide exceptional patient care services to the public. Now that leads us to today's guest, Sandra Hanna. Sandra is a pharmacist, but also the CEO of the Neighbourhood Pharmacy Association of Canada. And Sandra, we are absolutely thrilled to welcome you on the show today.
Thanks so much for having me, Nick.
Before we begin with today's conversation, Sandra, we'd love to have you further introduce yourself and provide a little autobiography or background. And then also, if you could share about the Neighbourhood Pharmacy Association, that would be appreciated.
Of course. Well, as you said, Nick, in addition to being the Chief Executive Officer at the Neighbourhood Pharmacy Association of Canada, I'm also a practicing pharmacist, and I own and operate a pharmacy just outside of Toronto in a community called Guelph, Ontario. Before I joined Neighbourhood Pharmacies, I actually spent a number of years running a consulting practice working with community pharmacies in the pharmaceutical industry, in the areas of professional services and business development and strategy. I quickly learned that I am really passionate about helping pharmacies to deliver patient-centric care while still being able to drive business in pharmacies and in community pharmacies. So I really feel privileged serving in this capacity at Neighbourhood Pharmacies as CEO, especially at this critical moment. Being involved in the association's work and influencing health policy, especially this year, has been incredibly rewarding. A little bit about Neighbourhood Pharmacies. So we are Canada's leading pharmacy trade association representing community pharmacies across the country. Our members represent about 2/3 of the community pharmacies across Canada. There are about 11,000 pharmacies across Canada, and we represent all different kinds and formats of pharmacies: chain, independent, long-term care, and specialty. We work with governments, both federal and provincial, as well as with other pharmacy associations in the health and other health sector stakeholders to help define the value that pharmacies deliver in patient care. What's really interesting in Canada is that about 95% of Canadians live within a 5-kilometer radius of a community pharmacy. And Canadians actually see their pharmacists up to 10 times more frequently than any other healthcare provider. So the pharmacy is generally the first and most frequent touch point that most Canadians have with the healthcare system. So we think that really represents a huge opportunity for pharmacies to be able to play a significant role in patients' care in general. Our members are in just about every community across the country, making pharmacies truly accessible on the front lines, both of public health and primary care.
Excellent. Thank you for that background, Sandra. And I would really underscore whether it was your own background, it speaks to the just variety of opportunities that there are for a pharmacist, and then your commentary about your members and the Neighborhood Pharmacy Association, that really pharmacy, we are that neighborhood face of healthcare, which is fantastic. Now, before we jump into the content for our show, I'm going to provide a quick overview of what comes next. There are 3 questions written down for us to explore. I'll go down the list and I'll ask the first question. Sandra, you'll then get to respond, and we may have some back and forth to summarize the key points. We're then going to repeat that process for the second and third questions, which will wrap up our content for this recording. But before we close, we're going to have a fun or exciting closing and summary. Now that we've described the process, let's jump into question 1. And Sandra, we're going to start with the obvious topic, and we're going to get that out of the way. COVID-19 certainly had a huge impact in 2020, and we are continuing to see that in these early stages of 2021. COVID-19 has kept pharmacists and pharmacies very busy as that most accessible healthcare provider that we just spoke about. So we're going to start off and would love to hear your response about what have pharmacists in Canada been doing with regards to COVID-19? What have they been doing in their local communities? And what has been different from the start of the pandemic towards the more recent time?
Yeah, Nick, so it's a really interesting question. And in Canada, actually really early on in the pandemic, a lot of healthcare capacity was really, really strained as it was right across the world. But also a lot of primary care providers had to shut down their doors. So we actually saw governments requiring primary care physicians' offices to shut their doors and to operate only virtually. So pharmacies actually served as really, really critical health hubs for Canadians right across the country because they stayed open right throughout the entire pandemic. Pharmacies were early on designated essential services, which meant they were required and able to stay open when other retail and services had to shut down. Other healthcare providers had to shut down. We had hospitals right at capacity, and public health certainly was at capacity managing the pandemic in the early days and right throughout, really. So pharmacies became really, really critical as service providers and as resources for patients and for Canadians. In fact, in order to be able to continue to serve Canadians effectively and safely, pharmacies had to do a lot to retool their infrastructure, to provide additional services, to expand their delivery services, to increase cleaning and sanitization, to acquire PPE, and in many cases, even just to put up physical barriers and signage in the stores to make sure that everybody within the stores, both customers, the public, and staff, stayed safe. And actually, we did some research and some analysis right at the beginning of the pandemic, and we found that our members invested in pharmacies. The pharmacy sector invested close to $1 billion just within the first few months of the pandemic to adapt their locations and implement their processes to continue to serve their patients safely and effectively. And pharmacists also continued to expand the role and the services that they provided to Canadians throughout the pandemic. So early on, we saw pharmacists, and certainly in the U.S., pharmacists were doing similar services, delivering asymptomatic COVID-19 testing. So this became a really important way for pharmacists to help support the public health system and the testing centers, which were really struggling to keep up with the number of tests, specifically early on in the pandemic. Pharmacists have also been at the front lines of public health with vaccination administrations. This year, for the flu season, pharmacists administered over 5.6 million flu vaccines, which really has increased significantly from year years past, and we continue to see an increase year after year in the number of vaccines that pharmacists deliver. In preparing for the COVID vaccine, we know that pharmacists are going to be a really, really important provider, not only to help from a human resources capacity, but pharmacies themselves are going to be critical in being able to administer the capacity at the scale that we anticipate will be needed to meet the needs of all Canadians. Again, we ran a survey with our members to understand the number of pharmacies and the capacity that those pharmacies can bring to a vaccination campaign. And out of the 11,000 pharmacies across the country, 90% are already administering vaccination services. And so that really allows our members, through their reach and their access, to be able to deliver close to 3 million vaccines per week, given the adequate distribution and supply, of course. So we know pharmacists are going to continue to play a really, really important role, not only in general vaccination services, and they did play that important role throughout the first months, or I guess now almost a year of the pandemic, but we know that that's going to be a really, really critical role that they're going to play moving forward to getting us out of the pandemic. Pharmacies have also been, accessible providers for primary care. Again, with primary care providers in many cases having to shut down their doors, pharmacists have been able to demonstrate resilience and commitment to patients through their infrastructure and as essential services through their accessibility, and have really picked up in terms of prescribing and medication management services and continuity of care through providing those services when other healthcare providers have not been able to do so. And we've seen the scope, and we've seen regulatory barriers be knocked down in many cases to enable pharmacists to help Canadians in those areas where they didn't have access to other services. So just to conclude, I think, finally, looking forward to the COVID vaccination, campaign, we're just getting ramped up in some provinces now to get pharmacists engaged and pharmacies engaged in delivering the vaccine. And we think it's going to be, a really, really important and key time for pharmacists to step up and help to bring us to recovery.
Thanks, Sandra. I'll put my next question for you, or actually a follow-up to just your statements there. I'm really interested in your commentary on primary care and how pharmacy has stepped up. You mentioned prescribing and medication management, and the medication management part here in the United States anyways, pharmacists are involved with that. Prescribing, it's on a case-by-case basis, but it's usually limited, controlled from a regulatory standpoint, but also interested with the primary care. I mean, does that include health screenings like blood pressure or hemoglobin A1C, lipid panels, et cetera? Would be interested to see if you can provide a little bit of additional detail, because I think our pharmacists here in the U.S. would love to hear, hey, this is what pharmacists in other countries are able to do during the pandemic situation. And let's see if we can learn to do some of those same things under this type of situation.
Yeah, it's a great question, Nick, because in Canada, every province has some different regulatory environment. And so every province, the scope of pharmacists is different. In some provinces, the prescribing authorities for pharmacists are very, very broad, and in some, they're a little bit more restricted. So, I think the areas where we see pharmacists playing a really important, let me say, the areas where we've seen pharmacists play a really, really important role over the past year in prescribing is in opioid management, actually. This has been a really, really interesting one, because the federal government actually issued an exemption to the Controlled Drugs and Substances Act, which really regulates who can prescribe, adapt, renew, deliver, really handle opioid prescriptions. And early on in the pandemic, the federal government recognized the important role that pharmacists can play in this space, and actually issued an exemption that enabled pharmacists to play an expanded role in opioid management. This was tremendously important for patients who are on opioid agonist therapy, patients who were on prescribed opioids and maybe couldn't get access to their physicians. It was critical to enable pharmacists to deliver prescriptions to patients who couldn't get to their pharmacies, to ensure continuity of care for patients who couldn't access their physicians and needed renewals. So it was a really interesting exemption that we've really seen play an important role in how pharmacists have been able to support their patients. You also asked about point of care testing. So that's an area where, we've seen some, not a tremendous amount of movement in that space over the past year. However, that has been, an advancement that we've seen in those provinces who have started doing COVID testing. So, we've seen those expansions in scope in some provinces where those scope expansions have been done in order to facilitate COVID testing. And those are areas where we'd really like to build on that momentum and expand the role that pharmacists can play more generally, as you said, in disease screening and medication management and chronic disease management.
Thanks for that response, Sandra. Yeah, the opioid point aspect, was not expecting that, but that sounds like an incredibly powerful opportunity. And speaking about what pharmacists are doing, let's transition to our second question, because we are able to expand. We're able to really show our value in the healthcare system to the patients and to the payers by our actions. And it just so happens that in the last few weeks, at least here in the United States, and you referenced it yourself, COVID-19 vaccinations have started to become largely available at pharmacies. So if there were ever a time to shine a light on pharmacist heroes, it's now. It's during the Pharmacist Appreciation Month, right, when pharmacists are really hands-on managing the pandemic and administering vaccines to help us get through it. So whether it's COVID testing, patient education, outreach, immunization, this all goes to underscore that pharmacists have a vast array of talents, and they're prepared to do many different services related to patient care, in addition to the simple and tried and true act of dispensing medications. We're always going to have that part as pharmacy, but there's a lot else that we can do. How are you seeing pharmacists prepared for this distribution of vaccine? Which vaccines are you seeing being offered? And just how, in Canada anyways, are patients being eligible to get that vaccine?
Yeah, so I mentioned earlier that we worked with our members to understand their capacity and sort of who's planning to offer the vaccine. What I didn't mention is that our national professional organization, who we work very closely with, also ran a public opinion poll to understand where the public stands on this. And nearly 2/3 of Canadians surveyed in that poll said that they would get a vaccine at a pharmacy. This year, we've also seen that more than 50% of Canadians got their flu shots at pharmacies. And so when we think about the COVID vaccine, I think the nice thing is that vaccination is not new to pharmacists, and getting a vaccine at a pharmacy is not new to Canadians. So this is a system and a process that people are pretty familiar with. We know, though, that this vaccine is a little bit different, than a typical flu vaccine, for example. It's multi-dose. The logistics are a little bit more complicated. So we are working with government to figure out how that all rolls out. But, we actually have just recently approved the AstraZeneca vaccine, and we're looking at, how to best utilize the different providers in the system to ensure that we have best access to the vaccines for Canadians. So to date, what we've been doing is we've been using the Pfizer vaccine in some of the mass clinics, the public health unit run mass immunization clinics. And because of the logistical challenges, we've really looked to use things like the Moderna vaccine and future more stable vaccines in the broader vaccination campaigns. And it's interesting because they're kind of referencing the mass vaccination clinics versus the vast vaccination clinics, which I think is a really neat way to describe it, because really, truly, pharmacies and primary care are really going to make this vaccine much more vastly accessible in communities right across the country. And so when we look at, the COVID vaccine, we do in most provinces leverage our pharmaceutical distribution system and our wholesalers to distribute vaccines to pharmacies. So, that's something that we would see as a really great opportunity to support public health and be able to help leverage some of the infrastructure that we already have in place to be able to make that vaccine more accessible in all communities across the country. Of the country. And then in terms of how Canada's rolling out the vaccine, Canada is, similar to the US, rolling out the vaccine by priority. So, having those priorities by patient populations to ensure that those at highest risk get vaccinated first. That's an important role as well for pharmacists to help manage and to ensure that, those at highest risk get vaccinated first. The one thing that we've been really saying, though, from the start is that we know pharmacists and pharmacy teams are going to play such a significant role in immunizing the public. And we just need to make sure that pharmacists get vaccinated so that they can be protected and ready to immunize the broader public.
Absolutely. Now, with regards to the vaccine or vaccines, what has your group seen? What have pharmacists in Canada seen around patient education and the vaccine? Right, there's a lot of questions around that and whether or not the vaccine is safe. Was it developed too quickly, too promptly? Is this going to have an impact? So what have you seen in Canada that's been effective for helping patients to understand that, yes, this is going to be a safe vaccine? Like all medical treatments, it comes with risk, but how have pharmacists in Canada been managing that?
Yeah, so that's a really interesting question too, because I think right across the globe we're seeing a significant level of vaccine hesitancy. I mean, we've never seen a global effort this size to come up with a vaccine. And so it seems fast, but if we look at the number of hours that have been invested into this development, it's incredible how much work has gone into it. I think that does not discount the fact that there are certainly a good chunk of people who are vaccine hesitant. And I think what we really like to focus on is that movable middle, because there is a movable middle who has sort of said in a number, there have been a number of different polls and, surveys that have looked at, will you get it? Yes, I'll get it right away. And then there's the percentage of folks that will say, nope, not interested at all. But then the majority are sort of in that middle who will say, yeah, I think I'll get it, but I think I'm going to wait a bit, or I'm not so sure. I'm not totally, for it, but I could be convinced. And that's an area where, we think pharmacists are going to play a tremendous role, because, those who are rushing to the front of the line to get their vaccine, we're happy to see that. But then there will be that movable middle where pharmacists are going to play such a significant role, because we have the trust of the public, we have that frequent contact with the public, and we have those relationships that are longitudinal with the public and with Canadians. And so we can leverage that trust and make those recommendations at every interaction, really, to prepare Canadians for getting the vaccine when they're eligible to get it. So I think that's a really, really important role that pharmacists will play. And absolutely, Nick, you nailed it. There's a lot of, it's right across the board in terms of where people stand here. But I think pharmacists are going to play a tremendous role here.
There's a phrase I often hear from a pharmacist that every encounter matters. Every patient encounter matters, right? And you already referenced, Sandra, that the pharmacists or patients are seeing their pharmacist 10 times more than they are typically any other provider. That makes a difference, right? Because patients, they are consuming from social media, from news, from friends, family, everything else that's there. And some of those sources may be good sources of information, but it's not always that case. So it's important for the pharmacist, for the healthcare provider, as the trusted medical professional, to use and share their knowledge whenever they're able to.
And I think it's twofold, Nick, to your point. We have that frequent contact with the patients, and we know that people make the majority of their vaccination decisions on the recommendation of a healthcare provider. So we have that many, more interactions with patients to be able to make those recommendations and to be able to make strong recommendations that are evidence informed, and healthcare provider based. But the other area where we know pharmacists have a really, really important role to play is on adherence. We know pharmacist engagement with patients and interaction with patients leads to improved adherence in general for chronic medications. And I think this is going to be critical too for this multi-dose regimen, to ensure that, we're there, we can follow up if there are any adverse effects, or if there are any questions about the vaccines after the first dose, to ensure that patients are informed and have somebody who they can contact to make sure that they can come back for that second dose to get fully immunized.
Yeah, Sandra, let's take that momentum now from that discussion that we just had, and let's apply it to our third question for today. And while we have focused on pharmacist impact for COVID-19 disease management, changes to the pharmacy practice, vaccine administration, and those works, that's the here and now, and that's the biggest elephant in the room. But pharmacists and pharmacy have a lot of elephants in the room that are preventing us, whether it's here in the United States for me or whether it's for you and your colleagues in Canada. There's still a lot of things that we need to change so that pharmacists are really able to practice to the fullest of their capabilities to improve patient care. So for our third question, I'd like to open it up for you. What is the Neighborhood Pharmacy Association doing to address other opportunities for pharmacy? And some of this may still relate back to COVID, or maybe it's going to be how COVID has shown other shortcomings related to, patient care and how pharmacy needs to get into the game more. So from your standpoint, again, COVID-19 has taken over, but what else are you doing to help support pharmacists and pharmacy?
It's interesting, Nick, because we actually identify at the beginning of every year our key priorities in terms of advocacy. And even prior to COVID, our priorities really have been around, expanding pharmacy's role in primary care, expanding pharmacy's role in public health, expanding pharmacists' scope to be able to do things like prescribing and point of care testing, to support the primary care and public health system, helping pharmacists to play a more significant role in managing the opioid crisis. Whether it's through scope or whether it's through utilizing potential opioid-sparing agents like medical cannabis. Interestingly, most of what we were focused on before COVID has really come to light during COVID as, really validated, I guess. COVID has really validated that these are all the right areas where it's appropriate and practical and necessary for pharmacists to play a more significant role, and where Canadians want to see pharmacists play a significant role. So, interestingly, we've really seen our key priorities come to light and really be confirmed during COVID. So, some other areas where we want to continue to see advancement in pharmacy is, in the area of vaccines. Certainly, we know that we're going to play a role in COVID vaccination, but beyond that, we'd like to see pharmacists play a more significant role in immunization programs in general, and not just flu, but routine immunization, children's, routine childhood immunizations, routine adult immunizations. Pharmacists are well trained and able to do it. Canadians have, we use the term voted with their feet. They go to their pharmacies. That's where they want to receive their vaccines. So let's expand and increase the vaccination rates for more routine vaccinations by leveraging pharmacists and making it more convenient for Canadians. For medical cannabis, this is an area where, we're still working with the federal government to understand and to determine where cannabis health products will be sold, for example. So this is an area that, we anticipate we're going to start seeing a little bit more movement on this year. And it's, we believe strongly that pharmacists should be the ones selling cannabis health products, because we're seeing Canadians self-medicate. We're seeing increases in the use of medical cannabis for things like sleep and anxiety and pain. And so we believe that those, that Canadians need to have access to a healthcare provider to help support those decisions. And finally, national Pharmacare is another area where we've been engaged in discussions with government. And in Canada, we have a very public healthcare system, but we still have private coverage for drugs in many cases. And for the most part, that works really well, actually. About 80% of Canadians are very satisfied with their drug coverage, whether public or private. We do know that some people don't have access to medication coverage at all, and we think that's a problem. And so we need to address the uninsured population. We also know that some people may have access to drug coverage, but may have insufficient access to drug coverage and still have high out-of-pocket expenses. So we think there's an area there to support as well. So we believe really that a national pharmacare program should focus on those who are uninsured or underinsured. And that's an area where we're going to continue to work with the government to help provide our expertise and our lens on that issue.
Sandra, thanks for the response. And as you explained what you're doing in Canada, a lot of that rings true to what I see and hear in the United States. So while we are separate countries and have very different healthcare systems in some ways, it sounds like pharmacists are trying to win a lot of the same battles, whether it be related to COVID-19 or otherwise. So I know here in the United States, it's important we talk about how important it is for pharmacists to be involved with their associations, be it local, be it national. There's various professional groups and subsets of pharmacy, and I'm sure for you and for the others in Canada that it takes much of the same approach. Where in order to help get these wins for pharmacy, we need people to be involved in helping to promote that voice for pharmacy.
Absolutely. And, previously, we'd always say, we need you to step up and we need to really demonstrate and tell our story. And I think this year we've really been able to tell our story, and it's been a really great opportunity to tell our story in terms of how we can really help, support the system and support Canadians.
Great. Well, Sandra, it was a pleasure to have you on the Quality Corner show today. And thanks again for enlightening us about all the work that your organization is doing and for sharing the positivity about the pharmacy profession. I think I could not underscore enough how much it was important for you to share that, yes, it's, there are difficulties for pharmacy, but things are getting better here. And it's getting better because pharmacy is on the front lines and helping patients and helping their local communities. That's fantastic. It's also great for us to learn more about what pharmacy organizations are doing in other countries, even if it is just right across the border. And during the course of the Quality Corner show, we like to reference that education and learning are key components of the quality improvement process, and that is the overall focus for our show. So having you here to educate and teach about efforts in another country therefore addresses our key points of interest while also making for a different and still enjoyable interview. Now, as we do begin to wind down the episode, we typically have a fun question for our guest. And since you are calling in from another country, I did want to address a question as far as travel. And obviously here in the time that we're recording this episode in February 2021, travel is very limited, especially international travel. But let's just say that I, as an American who has never been to Canada, which is actually true in my case, I wanted to come and visit Canada. Do you have travel recommendations for your own country? And if you've got any recommendations for like cool pharmacies or pharmacy hotspots to check out while traveling, that would get you some bonus points for the answer.
Ooh, okay, Nick. Well, first of all, you definitely have to come visit Canada. And second of all, I am also an avid traveler, and I'm counting down the days until I can get back to exploring. So, interestingly, though, I've actually only really taken the time to discover Canada over the past 5 years or so. So I definitely have a lot of cool Canada tips. And, it's funny how you often forget what amazing things you have in your own backyard. And once I had my eyes open to that, I thought I need to do more of this. So I'll give you a few things. So if you're a foodie, I guess Toronto, Montreal, and Vancouver have, world-class restaurant scenes. Our maritime or Atlantic or East Coast provinces really have an amazing, different pace of life. They've got great music scenes and they've got out-of-this-world seafood. I'm also an avid snowboarder, so the Rockies and Whistler, have some of the best mountains and a great après-ski vibe as well. If you're a sports fan, I cannot recommend enough that you need to get to a Toronto Raptors game, of course, once they're playing live again, because Toronto has some of the best NBA fans in the league. And if you get to a game, it's always a good time. If you are a nature junkie, the country has a ton of national parks with some great hiking, great lakes, mountains, grasslands. And northern Manitoba actually has some of the world's best places to see beluga whales. And lastly, for the bonus question, if you are able to come to Ontario, and I'm an Ontario person, so I have to give my Ontario plug, but Niagara-on-the-Lake is a great, quaint little town just across the border pretty much from Buffalo. And there is an old antique apothecary there. So it's called the Niagara Apothecary. And it is a fantastic little museum pharmacy that's definitely worth a visit if you're in the area.
Excellent. Thank you, Sandra. You're definitely getting the bonus points for the pharmacy reference for the travel part. Appreciate you hit on the outdoors, you hit on the sports. Would add that if you're going to a Toronto Raptors game, it's very likely you get to see Drake, maybe from a distance at the stadium, but it's there. And I really appreciate the recommendations. Sounds like there's a lot of good food in Canada as well from your description. So as a foodie myself, that sounds intriguing. And as I've picked up watching a lot of Canadian-based comedies during the pandemic, it sounds like I would like the people in Canada. So I really appreciate that. Sandra, one absolute final question for you. And you've provided a lot of great information today. I'm sure our listeners may have a question for you about either the Neighbourhood Pharmacy Association or how just generally Canadian pharmacy operations. So if somebody has a question, how can they best contact you?
Well, you can reach us and me by email at info@neighborhoodpharmacies.ca. I have to stress that neighborhood is spelled the Canadian way, so with an O-U-R. We also just launched a new website, neighborhoodpharmacies.ca, and actually launched a brand new magazine about midway through last year called the Neighborhood Pharmacy Gazette, which you can actually subscribe to for free at our website, neighborhoodpharmacies.ca. We're also active on social media and on LinkedIn and Twitter. You can find us at pharmacy_can, as well as on LinkedIn at neighborhoodpharmacies.ca, Neighborhood Pharmacy Association of Canada, sorry. And we'd love to hear from you.
Excellent. Well, Sandra, thank you again for this conversation today. Really helpful information, and really appreciate what you're able to share about the Canadian pharmacy experience. With that, we have now officially finished our content for today's episode, and we're going to wrap up. So we do appreciate, we hope our listeners take the time to thank a local pharmacist for their hard work during this Canadian Pharmacy Appreciation Month, even if you're here in the U.S. Always a good thing to do. Always a good thing to thank your pharmacist. And if you like today's episode, or if you have questions or comments about the Quality Corner show, please feel to reach out to us. You can reach us on Twitter at pharmacyquality.com for a quick response, and you can specify that your question or comment is about the Quality Corner show. Similarly, if you have a topic and would like to come on the show and talk about it, we would love to have that. Sharing new information and meeting new guests is what really makes this show special. Now, with that, I again appreciate you listening to the Quality Corner show, and there is one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.